Hello future nurses. Confused about electrolyte imbalances? In this video, let's make phosphorus imbalances, that is hypophosphatemia and hyperphosphatemia, clear, including causes, clinical manifestations and management using easy mnemonics so that you never forget. So let's begin. Phosphorus. The normal level of phosphorus is 3 to 4.5 mg per deciliter. Now, the normal level is 3 to 4.5 mg per deciliter. That means two conditions occur when phosphorus is out of balance, either hypophosphatemia or hyperphosphatemia. So, before discussing the condition, let's discuss reciprocal relationship. What is reciprocal relationship? A decrease in the serum phosphorus level is accompanied by an increase in the serum calcium level, and an increase in the serum phosphorus level is accompanied by a decrease in the serum calcium level. This is called a reciprocal relationship. So, reciprocal relationship is between phosphorus and calcium. That means when there is decrease in serum phosphorus level, serum calcium level is increased, and when the serum phosphorus level is increased, that is accompanied by decreased serum calcium level. So this is the reciprocal relationship. So whenever we are correcting calcium or we are monitoring for phosphorus, we have to consider the other electrolyte. While monitoring phosphorus, we have to keep an eye on the serum calcium levels. So this is the reciprocal relationship that is between phosphorus and calcium. Now let's discuss hypophosphatemia. Hypophosphatemia, a condition in which serum phosphorus level is less than 3 mg per deciliter. Now, phosphorus level is below the normal value, that is below than 3 mg per deciliter. The causes for hypophosphatemia. We know that hypophosphatemia is a condition of low phosphorus. So the mnemonic for causes is low phos. It is easy to remember the mnemonic low phos. Let's study L. L stands for low intake, that is malnutrition, starvation, or alcoholism. Due to inadequate dietary phosphate intake, there is decreased level of phosphorus in the body, and low intake can be due to malnutrition, due to starvation, or due to alcoholism. O. O stands for overuse of antacids, mainly the phosphate binding antacids. If there is repeated and excessive use of antacids, then antacids will decrease the intestinal absorption of phosphate, mainly the phosphate binding antacids, because they will bind phosphate, so less phosphate is absorbed from intestine. So due to which there is less phosphorus in the body. Our serum phosphorus level is less. W stands for wasting of kidneys, mainly diuretics. Certain diuretics or kidney disorders also increase phosphate excretion. So if there is increased secretion of phosphorus from the body, so the result is decreased phosphorus level in the body. P. P stands for pulmonary alkalosis. In condition of pulmonary alkalosis, that is respiratory alkalosis, the phosphate will shift into the cells, which will decrease the serum phosphate level. H. H stands for hyperparathyroidism or hyperglycemia. In condition of hyperparathyroidism, there is increased renal phosphate excretion, and in case of hyperglycemia, more phosphate shift into the cells and serum phosphorus level decreases, means that is serum hypophosphatemia. O stands for oncogenic osteomalacia. Oncogenic osteomalacia is a tumor which secretes a hormone, and this hormone causes severe phosphorus loss from the body, resulting in decreased phosphorus in the body. Means from kidneys there is increased excretion of phosphorus due to a hormone which is secreted due to the tumor of oncogenic, that is called oncogenic osteomalacia. S. S stands for severe burns or septic shock. And these are the condition of stress. And in states of stress, there is increased phosphate consumption and also increased loss. If there is increased consumption as well as increased loss, so the resultant serum phosphorus level is low. So these are the causes for hypophosphatemia, and the mnemonic is low phos, low intake, overuse of antacids, wasting of kidneys, pulmonary alkalosis, hyperparathyroidism or hyperglycemia, oncogenic osteomalacia, severe burns or septic shock. Let's discuss the symptoms or the clinical manifestations that will appear due to the condition of hypophosphatemia. And the mnemonic for clinical manifestations is weak. Now, we know that if this is a condition of hypophosphatemia, then there will be increased calcium level, that is hypercalcemia. And in case of hypercalcemia, we know that calcium is essential for muscles. If there is hypercalcemia condition, so muscle weakness will occur, or we can say brain symptoms will occur, osteoporosis, bone pain. So similar symptoms can also be seen in the condition of hypophosphatemia. So it is easy to remember these clinical manifestations because we can correlate these symptoms with hypercalcemia symptoms. So the mnemonic for clinical manifestations of hypophosphatemia is weak. W stands for weak muscles. Muscle weakness will occur. Muscle weakness occurs because in condition of low phosphorus, there is decreased ATP production. And if there is less ATP production, so muscle weakness occurs. E stands for energy low, so fatigue, malaise. As I already told, that due to less phosphate, there is less ATP production because phosphate is needed for ATP. So ATP is a form of energy. If there is decreased ATP, so generalized fatigue, exercise intolerance or malaise can occur. A stands for altered mental status, confusion, irritability, seizure, coma. So brain cells also require energy, that is ATP for functioning, and for ATP production phosphate is necessary. If less phosphate, less ATP, so the brain function is impaired, due to which there is altered mental status symptoms including confusion, irritability, seizures, coma. K stands for cardiac issues, arrhythmias, decreased contractility, or cardiomyopathy. These can occur due to muscle weakness, and which is due to the decreased energy supply to cardiac muscles, due to which cardiac issues like arrhythmias, decreased contractility, or cardiomyopathy occurs. So these are the clinical manifestations for hypophosphatemia, and the mnemonic for this is weak muscles, low energy, altered mental status, and cardiac issues. Management for hypophosphatemia. If this is a condition, hypophosphatemia means there is less phosphorus in the body. So we need to, for management, we need to give more phosphorus. So the mnemonic for management is PHOS, where P stands for phosphate supplements. We have to encourage or we have to promote the consumption of phosphate. For that, we can give phosphate supplements also. Oral phosphate supplements are given if it is a mild case, but if in case of severe hypophosphatemia, we have to give IV phosphate. H stands for high phosphate diet. If there is less phosphate in the body, then we have to give high phosphate diet. High phosphate dietary sources include meat, fish, poultry, milk, cheese, yogurt, nuts, beans, and whole grains. So we have to encourage foods that are rich in phosphate. O stands for observe symptoms and laboratory values of calcium, magnesium, and potassium. Calcium level is important to monitor because of the reciprocal relationship, and also we have to monitor magnesium and potassium values, and along with monitoring of these lab values, we have to observe symptoms like muscle weakness, arrhythmias, confusion, bone pain. We have to observe all those symptoms. S stands for slow correction to prevent complications like hypocalcemia and arrhythmias. Whenever we are correcting phosphate, mainly when we are correcting phosphorus by IV route, we have to correct slowly so that the complications can be prevented. Complications like hypocalcemia, and because of hypocalcemia, tetany can occur, or arrhythmias. And hypocalcemia complication is again related to the reciprocal relationship between phosphorus and calcium. So this is the management for the condition of hypophosphatemia. The mnemonic is PHOS. Phosphate supplements, high phosphate diet, observe symptoms and lab values of calcium, magnesium, and phosphorus, and slow correction of phosphorus to prevent further complications. So, this is the condition of hypophosphatemia. Stay tuned for easy explanation of other electrolytes in upcoming videos with Smart Mnemonics with SmartNurseGuide. Thank you.